Hey, let's save the tooth. Hi guys, I'm Dr. Peter from Dental Designs in Singapore, and today we're talking about if a tooth has decay, can it be saved? Sometimes these days it's easy to think, if I've got a tooth with decay in it or a cavity, can I just take it out and put in an implant? And implants are really good, but they're not always the best option for every situation. And in dentistry, everything has a bit of a time span. So ideally, trying to push off needing an implant earlier when you're younger is good, because then hopefully when you need it, when you're a bit older, it will just last the rest of your life, hopefully. So today we're going to talk a little bit about decay and kind of give you an idea about what we think about and what we do here in Dental Designs. So dental fillings are a great way to save a decayed tooth, and there's many different types of fillings that we can do. Sometimes just normal small ones. Sometimes if it's a bit deeper, we might use like something called a base, which is like a medication over the filling. And sometimes if it's really big, then we can start talking about ceramic fillings or even crowns. And so those are a number of ways that we can make your teeth last a lot longer. So this first little slide here, I thought it'd be nice just to give you a little idea about what tooth decay is. This is a nice image from a little study, and it kind of just shows different stages of decay. So the first one is on this left-hand side here is actually just what we call early decay. And this stage is just a little bit of surface damage to your tooth structure. And this is actually a really good time to catch the problem, because with good oral hygiene, with regular cleans at the dentist, and a bit of fluoride application, we can actually stop that at that stage and even reverse it. So that's a great time to be very preventive. If we move to the next stage, we're looking at now the cavity's gotten a little bit bigger, the decay's gotten a little bit bigger, and it's broken through into the inner part of your tooth. And at this point, what you might start to notice is a hole, or you might start to see like discoloration in what used to be the white part of your tooth. In this point here, now we probably need to talk about putting in a filling in the tooth. And depending on the size of the filling, maybe a slightly stronger filling might be needed. Now, if we move on to the next two images, these are when things get a little bit more severe. The decay has actually gotten past all the tooth's natural barriers, and now it's into the nerves of the tooth. Often in these stages, you'll experience a lot more pain. So once the decay reaches into the nerve there, you often feel sensitivity to hot and cold. Sometimes a lot of throbbing pain, and the pain can be quite bad actually. It can kind of keep you up through the night. If things get even more severe, the bacteria actually go through that nerve all the way to your bone, and now you might start noticing like a swelling or a little pimple in front of the tooth there, and usually a little bit of tenderness on touching of the tooth. And so in those two situations, hopefully you've still got a decent amount of tooth structure left, and we can do what we call a root canal, and ideally like a crown afterwards. And that's a great way to save that tooth. So that's just kind of a few stages. I thought it would be good to kind of give you a few kind of real life scenarios so that you can kind of see what we're looking at when we're doing our dental checkups. So this patient here is a very typical case of where there's early decay. So if we have a little look at these areas just around the gum line, you see these little white brownish areas. This is a great time to be really preventive, really good oral hygiene. We encourage the patient to brush higher up around the gum line, really good cleaning regularly, ideally every 6 months, and fluoride applications in the area. And hopefully we can maintain this for a long time. If we move on to the next image, this is a very typical situation where that decay has just broken a little bit deeper into the inner part of the tooth, but not into the nerve. Here, a great treatment is just removing the decay, putting a nice small filling there, and that will do a really good job. This photo is, again, still the decay hasn't gone into the nerve, but it's a lot bigger. So we can see a lot of the darkness around the tooth there, and this also has a big old metal filling. In a situation like this, again, still good. We're not talking about root canals or anything like that, but we probably need to consider maybe something a little bit stronger than a normal filling, just because when it's replacing a bigger section, you want something really strong that will last a long time. So we're talking about something called like an inlay or an onlay, like a ceramic restoration, and that will work really, really well in a situation like this. This next image, I used an x-ray because this is actually a really good example of why x-rays are important in our checkups. This patient came in here having a lot of pain from this specific tooth. And when we look at the top of the tooth here, so where I've just drawn the arrow, I'll remove it for a second there. The top of the tooth is actually intact. So when we looked in the mouth, we actually didn't see that there was a big hole there. But when we took the x-ray, we saw this really big dark shadow over there. And essentially that decay had eaten out from the side of the tooth into the nerve, and that's why she was having a lot of pain there. Now, luckily, she's still actually got a lot of pretty solid tooth on the side here. So this tooth would actually be a really good case for a root canal and a crown, and she'll get a lot of years out of this tooth with that kind of treatment. So this is an example of why x-rays are quite good in a situation like this, and what we would do if the decay gets that quite bad. So a really good question would be, how long will this treatment last? The root canals, the crowns, fillings, everything. Now, here at Dental Designs, we strive to achieve the highest level of care. Our treatment is done all under magnification, even microscopes in some situations. And we have a lot of equipment here that allows us to achieve a really high standard of care. You can be guaranteed when you leave that you're going to have a really good treatment, but also it's really important on your part to look after the treatment. So a really important part of maintaining the fillings and the crowns and things like that is good oral hygiene. So good cleaning, brushing twice a day, flossing is really important, using a fluoride toothpaste is really important as well, and then coming for your regular dental checkups and cleans. By doing that, we can make sure everything lasts a long time, and we can keep you having your natural teeth for as long as possible before we need to talk about any kind of implants or anything like that. So that's just kind of our mentality and what we try to achieve here at Dental Designs. We try to make sure that your teeth last as long as possible. So I hope you guys learned a little bit about what tooth decay is and what we do here. Yeah, thanks for listening. Bye.